In Malagum Kagoro, as the sun rises gently over the hills, a quiet crowd gathers, not for celebration, but for survival. These are mothers, fathers, children, and the elderly. People who have lived for years with pain they could not afford to treat. Today, hope has come. The Jennifer Etuh Foundation is carrying out a 5-day free medical outreach targeting over 3,000 beneficiaries. Inside the Jennifer Etuh Specialist Hospital in Kaura Local Government Area of Kaduna State, the atmosphere is one of the urgency and compassion. Doctors consult, nurses reassure, volunteers guide patients who have waited too long for care. This outreach provides medical consultations, general and specialized surgeries, ophthalmology, dental care, gynecology, obstetrics, laboratory services, and free medication services many beneficiaries could never afford. For Lois Yunana, this outreach means the difference between fear and relief. Her son had lived with hernia since childhood.
Nice mai suna Lois Yunana. So na zo nan akan rashin lafiya. Saboda wannan taimako wanda wannan foundation din ta yi mana gaskiya mun gode domin yaro na ma ya samu an yi mashi aiki free ba wani an yi mashi hayaniya. So ba mu biya komai ba. So yanzu muna tsaya a madadi muna mika godiya ne a wannan lokaci. Allah ya kara rufe wannan da jininsa na Isa almasihu. Wahala ne ba za mu iya yin wani abu ba sai dai mun bar shi haka. In ya zama yaya ne to ba abin da za mu iya yi domin ba hanyar kudi akwai wahala.
Today, her son has undergone a successful operation free of charge. Nearby, Christiana Daniel watches over her 6-year-old son, also born with hernia.
Na kawo yaro ne a yi mashi aiki. Tun shekara 6 kenan yana fama da shi, na haife shi da shi. Ba kudi sai mun je dai mun karba magunguna. Ba mun biya komai ba. Gaskiya mun ba mun biya komai ba. Kai mun ji farin ciki. Wallahi mun ji farin ciki mun gode. Gaskiya farin ciki ne muna kai. Kuma ana yi yara suna tashi da karfi.
Inside the theater, surgeries continue, smooth, steady, without complications. One doctor confirms that the procedures are progressing successfully, restoring not just health but dignity.
What we are doing for this child is to bring down his testes, which has been in the abdomen, so to avoid the risk of malignancy. That is of it being cancer. The longer you leave it in the abdominal cavity, it becomes the risk of becoming cancer. So we're bringing it down. It's called orchidopexy. He also had a hernia with it. We are repairing the hernia first and then bringing down the testes to avoid that complication. So, thank you.
Speaking to Compass Times TV, the Foundation's program manager, Joseph Otu, explained the mission.
So I'm Joe Etuh, the program manager for Jennifer Etuh Foundation. This is one of the hospitals here, amongst our 6 hospitals here in Malagum Kagoro, and we're having a free medical outreach which will be spanning 5 days within this axis. Basically, so what we're doing basically is to complement the efforts of what the government is doing to see how we can do that in our own little way, where you get to see pregnant women and children come in. And
he added that the annual intervention is going in across 6 states of Nigeria, 1 hospital in each geopolitical zone.
For us, it's something that has been ongoing across the 6 hospitals that we have. We have one in Kogi, we have in Kaduna State where we are currently, we have in Gombe State, Cross River State, as well as Osun State and Imo State as well. So basically for us, it's been ongoing, and what we intend to do is that at least once in every year, we go to each of these hospitals to carry out this free medical outreach.
Beyond treatment, the outreach looks to the future, educating adolescent girls on body care, preventing unwanted pregnancies, and protecting themselves from sexually transmitted diseases.
They teach us how to use cotton sanitary pads and how to take care of our body system to avoid disease and prevent from pregnancy at tender age. Well, they are doing well and we really appreciate. And I pray that God bless the owner of this place and God continue to strengthen him so that he can be able to help those who are in need.
As the outreach continues, one thing becomes clear: this is more than medicine. It is compassion in action. It is hope delivered quietly. And for thousands of Nigerians, it is a second chance at life.